Welcome to Inside Talk on Cosmetic Surgery. I'm your host, Ann Guetta, and today we are at the office of Dr. Tammy Cassis, a board-certified dermatologist who will be discussing fillers with us. Welcome to our show, Dr. Cassis.
Thanks for having me.
Dr. Cassis, what exactly are fillers?
Fillers are a generic term that physicians use to describe a substance that we inject into a patient to restore the loss of volume.
Okay, and what areas in the face do you normally inject fillers into?
We normally inject the nasolabial fold lines, which are the lines right here,
Okay.
the marionette lines, which are the lines down here. We inject around the eyes, we can inject in the glabella, we can inject the earlobes, we can inject the hands.
Okay, and are these fillers FDA approved?
They are FDA approved. They are FDA approved. Some of the locations are considered off-label. Off-label isn't necessarily a bad term. It just means that they've been FDA approved for the nasolabial fold lines. So when we go off that area, we're doing it off-label.
Okay, and how often do patients need to get injections? How long do they last?
It depends upon the product, anywhere from hopefully 6 months to up to a year, maybe a little bit longer. It really depends upon the product.
Okay. Now, there are different kinds of fillers, so can you go into that a little bit about the different types?
Sure. The fillers that I use in my office are the non-permanent fillers,
Okay.
and they are broken down into the collagen-based, which would be Evolence. Evolence is a collagen-based filler, right here.
Okay.
And then there's the hyaluronic acid-based, and those are really two companies. Medicis came out with the first one. It's called Restylane.
Okay.
Second generation of Restylane, so a little bit thicker molecule, bigger molecule for deeper lines, is called Perlane. Lasts a little bit longer. With Restylane, you're going to get about 6 months, maybe a little bit less. With Perlane, 6 months, maybe a little bit more, closer to the year.
Okay.
With Evolence, hopefully closer to around a year. Again, with hyaluronic acid based would be the Juvederm and then Juvederm Ultra Plus. Again, the Juvederm Ultra closer to the 6 months, Ultra Plus maybe 6 months to closer to a year. Then there's the calcium hydroxyapatite, which is called Radius. Radius is for deeper lines, also great for the hands, the cheekbone area. This is going to last you closer to a year. And then Sculptra, which is one of our newest ones. This one is actually not FDA approved for cosmetic use. It's actually FDA approved for a medical condition called HIV lipoatrophy. But probably by the time this show airs, it will be FDA approved. It's right on the cusp. And this is the buzzwords of the liquid facelift.
Okay.
This one is injected completely different, so we'll show this somewhere down the road.
Okay.
And those are the different fillers.
At what age is it recommended to start with fillers?
It really depends. And so anywhere in the probably mid to late 30s would be the earliest that you want to start to do it. It just depends upon your facial volume loss.
And you combine fillers with other cosmetic procedures in your office. How do you do that?
Absolutely. Fillers are just one, we call it tool in the toolbox when you are looking at the cosmetic patient. So we use it a lot with Botox, we use it a lot with lasers, resurfacing lasers, intense pulse light. It's just one part of the whole system.
Okay. What does the cost range for these fillers run?
Anywhere from about $500 to $600 to up to $1,000. It just depends upon how much it costs the physician to purchase it from the company. So Restylane is roughly $500, which is this one here. Perlane, the Juvederm Ultra Plus, these are closer to the $600 range. Evolence, again, is closer to the $600 range. Radius would be closer to the $1,000 range. And then Sculptra, again, closer to the $1,000 range.
Okay. What type of patients would not be suitable candidates to have filler injections?
You want your physician to know your complete medical history.
Right.
When you come in for filler, you don't want to have had some alcohol the night before because it increases your risk for bleeding. If you're on blood thinners, if you take a lot of vitamins such as ginger or ginkgo or vitamin E, those are all things that are going to increase your bleeding and then increase your bruising risk. Other side effects or strange processes that you'd want your physician to know about, or if you have autoimmune problems,
Okay.
or diseases where you make granulomas naturally, something called sarcoidosis. So these are things that you would want to discuss with your physician.
So just disclose your medical history with your doctor.
Absolutely, absolutely.
Dr. Cassis, these are considered lunchtime procedures, right?
They are. Complications would be a little bit of bruising, a little bit of swelling, something that's easily covered up with makeup. And so somebody might know that you've had something done, but it's definitely a lunchtime procedure.
So they could have it done and go back to work with a little makeup.
Absolutely.
What types of training do dermatologists go through for fillers?
We go to medical school, just like any other physician, so 4 years of medical school, and then dermatology residency is another 4 years. Our first year is either internal medicine or pediatrics, and then the remaining 3 years are strictly dermatology. So when you're in the dermatology residency program, each year you are understanding all about all the cosmetics, so fillers, Botox, lasers, really understanding the biochemistry, how these materials work, and then most importantly, hands-on training. You are actually injecting, learning how to do these procedures, learning what you're good at and what you're not good at. And so when somebody likes to do these procedures, they're good at these procedures, then they can do advanced training and learn even more about it. So it's a wonderful profession.
So why is it important for patients to see a board-certified dermatologist for these types of injections?
Well, I think I'm biased because I am a board-certified dermatologist, but I know the training that I've gone through. I know the paces that I've had to go and what I've had to go through. So I think that, I consider myself one of the experts, but I'm biased.
Just check your doctor's credentials and make sure.
Absolutely.
Trainings.
Board-certified, you have to be continuing medical education.
Right.
You want your physician to be continuing medical education. You want that physician to have gone through all this training that they've gone through, so it's important.
Right. Where can patients find out more information about fillers?
Oh, there's a ton on the website. So if you Google any of these names, Evolence, Restylane, Perlane, Sculptra, Radius, Juvederm, you will come up with the company-sponsored websites where you can learn a bunch of information. And then you can go to my website, which is www.cassisderm.com, and we have all the links to get you to the different websites.
Well, great. Well, thanks for being a part of our show today, Dr. Cassis.
Sure, thanks for having me.
Now stay tuned as we see Dr. Cassis perform fillers on some of her patients.
Sun damage, genetics, acne, and even gravity can have a noticeable effect on our skin. Lines, wrinkles, and hollowing of the skin can occur, altering how the world perceives us. Fortunately, science has a solution: dermal fillers. Dr. Cassis uses several kinds of fillers to customize your treatment, whether you need help around the eyes, mouth, or hands. To learn more, call Dr. Cassis at 326-8588 or visit www.cassisderm.com.
We're back at Dr. Cassis's office with patient Diane, who's going to be receiving a radius treatment in her hand today. She received one treatment 3 weeks ago, and you can see the difference in this right hand, which has been treated, versus the left hand. Now, Dr. Cassis, tell us why Diane is an appropriate candidate for radius.
As we age, we lose volume in all areas, including our hands. And so when we lose volume in our hands, the prominent bones and tendons become obvious to see. So we like to fill in with Radius or Sculptra to just repair the volume that's been lost, to not make it look strange, but just give it a little bit extra volume.
Okay, now how long does a radius treatment last in the hands?
Hopefully about a year, maybe a little bit less just because of the dynamic motions of our hands, but usually it's about a year.
Great. Okay, Diane, are you excited?
I am.
Okay, I guess we're ready to get started.
Okay, so she's been sitting with some numbing cream on, and then we're going to do a series of injections in. We'll actually massage the radius throughout her hand, and then when we're done, we'll just have her sit with some ice packs, and she should be ready to go.
Now, do the hands usually bruise or swell after
They
the treatment?
do, yeah, they significantly do, and there'll be a significant amount of swelling afterwards. So it's a good 2 to 3 weeks that it'll kind of come back down to normal. So normally we have patients come back in 3 weeks. Diane's going to be out of town, so that's why we went ahead and did this hand first, and then she'll be out of town for follow-up.
Okay.
Okay, all right, here we go. Just do a 2x2. Okay, so here's the first little injection. Sorry. So it's kind of boring to watch, but
Is it painful, Diane?
No.
Okay.
I mean, she's going to initially feel the first little stick.
How many injections do you usually do in one hand?
It just sort of depends. So we'll do sort of a bolus at this aspect of her hand, Massage that bolus out. And then we're going to go into probably 4 injections here. Okay, straighten your hand out for me. Okay, great. All right, sorry. Pinch.
So maintenance just once a year, about?
Roughly, you never want to let filler go back to your original state.
Right.
And then that way you'll have to do less.
So do a lot of people combine
Don't hold too much in.
procedures with like the face and the hands
Oh,
because they don't want to
absolutely.
look uneven? You know?
Absolutely. Yeah, she definitely started with her face and then has worked her way down to her hands.
From head to toe, right?
Okay, so we're just going to do the 1 syringe, see where she gets with that. She may need to do another syringe, but you can see already where it's replaced
Right.
the volume. So
It really has.
going to swell a little bit, probably not a whole lot of bruising. She may bruise a little bit, and she'll just have to sit with the ice pack, and she's ready to go.
Great. Thanks, Diane, for being such a trooper.
Thank you, Dr. Cassie. No, you're welcome.
Dr. Cassis, tell us why Heidi's a good candidate for Restylane.
Heidi's a great candidate because she has some nasolabial fold lines, not very deep. And then we're going to do a little bit of injections down here in her marionette line area where she's lost just a little bit of volume. And then just a little bit here in the tear trough area just to help with the loss of volume around her eyes.
Okay, now this is your first time, Heidi, receiving injections.
It is.
You've had some other cosmetic procedures.
That's right.
So are you a little nervous today?
I am a little nervous, yeah, but no pain, no gain. So.
Yeah, sure. Okay, I guess we'll get ready to get started.
All right, Heidi, so the first couple sticks are always the worst, okay? Heidi's been sitting with some numbing cream.
Okay.
We like to have them sit with some ice just to help with the pain also, okay? So just try not to move, okay? Sorry. Ready? 1, 2, 3, pinch. All right, and here's the material going in. And it's pretty instantaneous. You can see the volume filling up very
How long does it
nicely.
last on the face?
It just depends. Everybody's different. Restylane will get you closer to the year. Restylane is the next generation of Restylane, made by the same company. Hyaluronic acid based. Another stick here. Sorry. Pinch. You doing okay?
Mm-hmm.
And you just want to soften and fill. You don't want to overcorrect. She's going to be a little bit red. She may have a little bruising, may even have a little injection site reaction where it's just a little bit more red. Other than that, she should be just fine. Okay, so that's her nasolabial fold line. That's about it. And then we're going to do just a little bit down here. All right, Jacqueline, just hold a little pressure right there for me.
Heidi, how does the pain compare with this to the other procedures you've had done?
It's actually pretty similar to Botox.
Okay.
If I had to, like the needle size and things like that. I mean, it's
I think it's a little bit more painful. Botox
little-
is so quick.
yeah.
You know?
Yes, exactly. The initial needle is like a Botox needle, but it with the fluid going in, it's a little
Okay,
more
so
intense.
so this you're injecting it deeper and massage. Okay, so it's a little more painful.
But there's numbing medicine on top. There's numbing medicine mixed in with it, so
Right.
it's not that bad. Okay, ready for down here? So new area, so you're not going to be quite as numb. All right, sorry. Pinch.
You can see the plumping already.
Yeah, that's pretty amazing.
Dr. Cassis, is she going to be bruised, swollen? Does she need special care after the injections tonight?
Yeah, we'll always send patients out with some ice packs, definitely some swelling, potential bruising for sure, especially if you've taken aspirin, if you're on any blood thinners, if you've had any alcohol the night before. Those increase your risk of bleeding, but not too bad. And we put a little arnica, which is a topical cream, on after they've had these procedures done, which help with the bruising to make it go away. So you can kind of see, you can compare her sides now, really, to see this side is filled up with good correction. Still looks natural, looks normal, and then she's got her nasolabial fold there and her volume there.
It's really instantaneous.
Yeah, it's pretty cool. Okay, so we're going to move around. I'm going to do this side over here. Just nestle down here just a little bit, okay? That's it. That's all she has to have done. So we'll get her cleaned up and put some arnica on, and she's done.
Dr. Cassis, what areas are you going to be treating on Wendy today?
We're actually going to do around the eyes for Wendy. Wendy suffers from allergies, so she has lost some volume, the tear trough area, and then just pre-sulcus area here. So we're actually going to be injecting a little bit more down here to replace the volume that's lost.
Okay.
And then we'll probably do a little bit in her chin here too, where she's lost some volume there. Okay, so it's going to be quick little shots along here, okay? Sorry, 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 just try not to move. Pinch, 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 sorry, sorry, sorry. You doing okay? Mm-hmm. Okay, another little shot here, pinch, pinch, pinch.
How long should the Restylane last under her eyes?
Oh, good 6 months. When you put it in sort of the less dynamic areas, so she's really not going to be moving this area so much, has a good chance of lasting the full duration. So I don't know if you want to just take a look. You can already see, and when you compare her side right there to this side, you can already see the volume correction.
Yeah.
Okay. All right. So you want to do your chin a little bit down here?
Sure.
Okay. The mental crease is sometimes we forget about the mental crease, and this is an area that just over time loses volume too. And so if we can just soften that up a little bit, it's not so noticeable for people. So it doesn't take a whole lot to do the eyes. And so when you're paying for a syringe, you know, it's nice if you want to do that area in conjunction with it. So the mental crease or the ear lobes. I think mistakes are made when you think one syringe is going to get your nasolabial folds, your marionette lines, your eyes, your mental crease. It's not going to work that way. But the eyes, it doesn't take a whole lot. Okay, we're going to switch to the other side. Okay, another stick here. Sorry, sorry, sorry. So Wendy has just, she'll only use one syringe of Restylane to do her eyes and to do her chin. She's catching it at, you know, when the lines aren't that deep, so she won't have to use as much.
All right.
That's it. We'll get you cleaned up and put some arnica on. She should be ready to go.
Great. Thank you.
You're welcome.
Wendy. Dr. Cassis, what are you going to be treating on Kathy today?
With Kathy, we're going to be doing her nasolabial folds, her marionette lines. She's lost some volume right here, so we're going to replace it here. And then we're going to put a little Perlane in her, around her eyes.
Okay.
So Evolence is a collagen-based product.
Okay. How long does it last in the face?
Close to a year.
All right.
With anything though, probably don't want to wait for it to completely go down. It's good to have the touch-ups, so then you can make it last even longer for you in the long run.
Is that painful, Kathy?
Just a little bit.
Okay.
Okay, now down here around your marionette lines. Sorry, 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 pinch. Okay, now Kathy doesn't like the lines that are right here on her chin, so we're going to go after those.
Okay.
Okay, sorry, sorry, sorry. Okay, so we've done one side, and you can already see the correction from this side to this side, the comparison.
Yeah, it's really cool.
And just how it softened this up from this side to this side. It'll be important for Kathy tonight to ice,
Okay.
sit with her head elevated a little bit. She'll leave here with some arnica on that will help with the bruising. Evolence, the way that it's made really helps reduce the bruising, so we like that for patients.
Okay.
But she may have some little localized injection site reactions. We like to, I mean, I am injecting, it's a needle going into the face, so there is some discomfort to it. So we use the ice to really help with the swelling, the bruising, then also help with the pain. So that's why my nurses will stand with the ice packs to help the patient. Pinch, 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 Kathy. You don't want to overcorrect. You actually would prefer to undercorrect or correct right at it. You want people to look natural, not to look overdone or processed. We all have lines, so you want to have some lines.
How do you feel, Kathy?
Good.
How is the pain?
It's okay. I mean, I don't have any pain now.
On a scale of 1 to 10?
10 being highest amount of pain. Well, I'd say probably about a 6.
Okay.
Just the initial stick.
Right.
And you've had Botox and filler,
Yeah.
or Botox and chemical peels.
But I've had the filler too last year.
Yeah, and then so compare all three, which most pain is what?
The chemical peel.
And then the least pain is?
Probably the Botox.
Okay, so we're going to do Kathy's eyes now. Kathy, it'll be a couple injections right here, so probably want to just keep your eyes closed, and then I'm going to kind of just push like this. We're actually going to do Perlane in Kathy's eyes, a little bit thicker volume. Kathy's lost a little bit more volume, so she needs the extra replacement there. Okay, and she's going to bruise right here. You can see, I mean, I usually can tell when I'm going to bruise somebody, so she's going to bruise just a little bit. But, I mean, when you compare her sides, it's already filled in. It looks great.
So just ice tonight?
Yeah,
and
just ice.
yeah.
Just the last couple of days. Okay, Kathy, we're going to move to the other side and do this side, okay? Okay, so she's definitely going to bruise right there. It'll last probably about maybe a week, but with the arnica and the ice, she'll be fine. And she can definitely cover it with makeup. So we got to get her cleaned up.
We'll be back in 3 weeks' time with Dr. Cassis and her patients for follow-up.
Sun damage, genetics, acne, and even gravity can have a noticeable effect on our skin. Lines, wrinkles, and hollowing of the skin can occur, altering how the world perceives us. Fortunately, science has a solution: dermal fillers. Dr. Cassis uses several kinds of fillers to customize your treatment, whether you need help around the eyes, mouth, or hands. To learn more, call Dr. Cassis at 326-8588 or visit www.cassisderm.com.
Welcome back. We're here again at Dr. Cassis's office 3 weeks post-injectable filler follow-up with her patients Wendy, Heidi, and Kathy. Diane could not be here today, but she had previously had one hand treated and had the other hand treated last time we were in the office with her. She's thrilled with her results. We're here to talk to Wendy again about her results. Hi Wendy, welcome back to our show.
Thanks for having me.
Now tell us, how were your results with the fillers?
They were good. I was a little tender, a little sore or tight on my chin for the most part. I had the Restylane done on my chin and underneath each eye.
Okay.
But especially in the eyes, I really could tell a difference just from my allergies. I had dark circles and just were real sunken in, so I could really tell a difference as far as just that youthfulness and plumping up right around, between my nose and my eyes. So they're good, like always. I'm very happy with my results.
Did you have any bruising or swelling afterwards? Discomfort?
No, I was just a little tight in my chin. I think I would almost, feel, if I pushed on my, right around my nose, I could feel a little bit, but nothing unless I pushed there. And on my chin, it was just a little tight for a couple of days. And other than that, it was fine. I had no bruising at all.
So really no downtime, so you're really happy.
No, it was great.
Good.
Wendy had a great result. I mean, her eyes look fantastic and her chin looks wonderful. And the no bruising I'm really happy that you had no bruising. Most patients will bruise a little bit, and so just have to kind of prepare for that, but she looks great. Hopefully the filler, she had Restylane, so hopefully the filler in her chin will last around 6 months, and her chin hopefully a little bit longer, and then eyes maybe a little bit longer than the 6 months, so it should be great.
Great, sounds good. Well, thank you.
Sure, thanks for having me.
Now we're here with Heidi, who had Perlane injected into her nasolabial folds. Heidi, tell us about your results.
I'm really happy with it. It was just a little tweak to kind of take away that hollowed look in my cheeks, so I'm really happy.
Did people notice a difference?
You know, my mom did, but no one else has really noticed. I've had to, you know, in order to get any feedback from it, I've actually had to tell people, you know, that I had it done. So it's been great.
Did you have any bruising or swelling afterwards?
I had one tiny bruise, but that was it. I really didn't have any swelling. I, you know, of course, did as I was told and put the ice packs on it.
Right.
So I had very little swelling.
Okay, well, it looks great.
Thanks.
It looks wonderful. I mean, it just softened up Heidi's nasolabial folds. She still looks natural. She's got a good result from it. So Restylane should hopefully last about a year with Heidi. And then the key to fillers is that you don't want to completely go back to your original baseline. So when it starts to wear off is when she'll need a little bit of a touch-up.
Okay.
So it's great.
Well, thanks for being part of our show again.
Thank you so much.
Now we're here with patient Kathy, who had Restylane injected under her eyes and Evolence into her nasolabial folds and marionette lines, and she's going to tell us about her experience. Welcome back to our show, Kathy.
Thank you.
Now talk to us about what your results were like. Were you pleased?
I was very pleased with them. I had something else put in there before. I don't remember what it was, but the Evolence did a much better job this time.
Okay. Did you have any bruising after the procedure?
I did have some right under my eye here and a couple places on my chin, but that was it, and it lasted maybe about a week or so or less.
Okay, great. So did anyone notice that you had anything done?
Yes.
Really?
Several people had said how much my face looked so much nicer.
Good. More youthful and
Yes.
contoured. Great.
Yes.
Kathy looks great. I mean, we've just softened up her lines, just filled in where she needed a little extra volume. And the point is well taken that she had your initial filler, and then we didn't wait for Kathy to go back to her original state. We built on what we had started, essentially, and so that's why she's so much happier this time with her results.
Okay. So it's good not to wait until it's
You don't want to go
done.
back to your baseline. You want to build on your results. So as soon as you start to see it wearing off or finding a new place that you need some filler, have it done.
So how long should this last in, Kathy, now?
Evelyn's hopefully a year, and then the
Great.
Restylane a year.
Wow.
in her eyes. Yeah, she looks
Great.
fantastic.
It's a long time. Great.
Yeah.
Well, thanks for being a part of our show again,
Thank
Kathy.
you.
We'll be right back with a recap of our show today.
Sun damage, genetics, acne, and even gravity can have a noticeable effect on our skin. Lines, wrinkles, and hollowing of the skin can occur, altering how the world perceives us. Fortunately, science has a solution: dermal fillers. Dr. Cassis uses several kinds of fillers to customize your treatment, whether you need help around the eyes, mouth, or hands. To learn more, call Dr. Cassis at 326-8588 or visit www.cassisderm.com.
To recap our show today, keep the following main points in mind. Number 1, board-certified dermatologists have particular training in injectable fillers, so check your physician's credentials and ask about any additional trainings. Number 2, ask your physician how often maintenance injections will be required if you are planning to do your fillers before a special event such as a reunion or a wedding. Number 3, always disclose your full medical history as well as any current medications you are taking to your practitioner before undergoing any kind of cosmetic enhancement procedure for the best and safest possible outcome. Number 4, injectable fillers can be combined with other cosmetic enhancement procedures such as Botox, chemical peels, and intense pulse light treatments to improve skin tone and texture, so it's best to schedule a full cosmetic consult with your dermatologist to discuss all of your options. Thank you for watching this edition of Inside Talk. Please join us next time as we explore more exciting ideas in the field of cosmetic enhancement. We'll see you soon.